Dr. Bodai, once someone has been diagnosed and they've decided to move forward with their treatment, beginning with chemotherapy, I just wanted to ask of you some of the side effects that one can experience with the chemo, the radiation, some of the hormonal treatments. And, I know for me, once I had to accept the fact that I was going to have chemotherapy, I was a little bit frightened by that.
Absolutely, and to be honest with you, surgical treatment of breast disease is probably the easiest part, even in those ladies who choose the mastectomy. And it's a very sensitive issue, but by far the worst part of the treatment is chemotherapy, because the chemotherapy basically knocks you down. The worst thing that the ladies experience is hair loss. The day their hair starts falling out, which is usually right after the first treatment, is probably the worst day in any woman's life. Here we've removed a breast or part of their breast. We've diagnosed them with a cancer, and now we've taken away their sexuality, because the chemotherapy basically puts you into menopause. We defeminize them by making them lose all their hair. They have all the symptoms of vaginal dryness, infections, terrible fatigue, nausea and vomiting. Even though we try to give them the very best drugs we have to counteract these side effects, they still are incurred by the vast majority of women. And basically you get a shot, and 2 weeks later you're starting to feel like a human being again, and then bam, it's time for your next shot. So you're right back into that horrible cycle. Just when you're starting to feel good again, we give you another blast of this poison. Mm-hmm. And it's poison. Chemotherapy, I call them stupid drugs. And the reason they're stupid drugs is they're very powerful and effective, but they're stupid because they don't know the difference between good tissue and bad tissue. So therefore they attack the entire body, destroying normal tissues too. And that's where all the side effects come from, the gastrointestinal upset, the infections, the hair loss, because these drugs don't know good cells from bad cells. So that's why I call them stupid drugs. In terms of the radiation does have significant side effects too. Notably fatigue. The ladies are pretty tired during the treatment. They can linger for a month or two after exposure to the radiation. The skin of the breast does change, the nipple changes, the consistency of the breast changes. Some women get a much firmer breast. Their skin gets very thickened, sensation in the nipple is decreased by the radiation, etc. And these changes, they are pretty much permanent. Once you get these changes, they're not reversible. And often they're delayed as well, so that the ladies can look and feel pretty good, say, 6 months after the radiation, 9 or 12 months after, they start noticing involution or enlargement of the breast, pain in the breast, and again, there's not much we can do about these things. In terms of the hormonal blockade, obviously if the lady's premenopausal, if we block the estrogen in your body, then you go into menopause. So you get the hot flashes, vaginal dryness, some women lose feelings of intimacy, they get the mood swings, fatigue, etc. So basically we put these women into menopause, and these drugs are given for a period of 5 years. In women who are, say, in their 30s and 40s, once they go off the hormonal blockade, they typically will get back some of their female qualities, in fact, to the point where they can actually have children, too, at that point, provided they're in an appropriate age group. So they can actually have children after treatment of breast cancer with chemo, radiation, and hormonal blockade. With the radiated breast, they probably wouldn't be able to breastfeed out of that side.
Thank you.